Hey community, this is Dr. Hugh coming at you again, and today I just want to go over another case of a 41-year-old female who's been basically destroyed in the system, living at home, has lost pretty much everything, and just has gotten just horrible medical advice to recover. The first thing that she wanted to do when it come to functional medicine or alternative medicine was stem cell, which was going to be $20,000. Not saying that stem cell is bad, but you have to have fundamental basic principles before you do any of the shiny coin things. So what I mean by that is functional medicine is basic 101 physiology, getting your body functioning optimally the way God designed your body to be. So what I'm going to do is I'm going to walk you through a case of someone that's suffering. And if you're out there watching this video, you're probably suffering. Get a hold of me. I help people all over the world. There's too much suffering out there. People are suffering, looking for answers, looking for someone that can guide them out of the trenches of just poor information and lack of love, lack of caring. And you'll see exactly in this case, this woman has experienced this. Her parents, who are very supportive, are helping her recover and get through this process. So what I want to walk you through is, have you had a workup like this? Have you had someone guiding you through the process of you getting better and to recover? Because at the end of the day, if you're alive, if you're breathing, God put the most amazing healing power in your body. We have to figure out why your body's not healing and functioning and do some polytherapy approach and get you out of the doldrums of disease and suffering, because God designed us to be healthy. God designed us to be well. So we need to figure out really two things. What's interfering with the problem and what are you deficient in? That's really where the whole functional medicine guided program comes in. So the blood work here gives us a basic foundation of where your physiology is sitting. Where's your physiology fitting? What's happening with your body? That's really what the blood work does. And then from there, we develop a game plan, and then we start to move the needle forward so you can start to recover. Okay, so in here, you can see these are all the labs that I have ran right in here. So all these are the different labs that we've ran. It's very extensive blood work. So let's get through this and let's see what's actually happening with her. I'm going to go over the highlights. So the first thing is, when we look at functioning someone, when we look at you getting better, or anybody who has a chronic problem, is there's a hierarchy of different things that you need to do. Meaning you always want to go over what I would consider the low-hanging fruit. And what I mean by the low-hanging fruit, it's taken me decades to come up with the low-hanging fruit protocol versus people go to the shiny coin and want to get the $20,000 stem cell procedure before they've actually reached for the low-hanging fruit, which is fundamental for your body to function and heal. You can do IV therapy, you can do stem cells, but if you have basic principles, basic physiology principles out of whack, like your physiology is out of whack to such a high degree, the stem cell just isn't going to take effect. The glutathione, the IV glutathione, isn't going to take an effect as if you had a stable foundation. So really what we're trying to do is do a stable foundation. So in this case, we're going to be covering a couple things. We're going to be covering sugar problems. So sugar problems, vitamin D levels, and inflammation. All this was caught, all this with me, and all this was not caught in the conventional system and the functional medicine stem cell person that she almost went to do. Okay, so glucose right here is, you can see this glucose level right here. It's 103. You can see the range, 65 to 99. So is that crazy, ridiculously high? I would say no. Someone that has diabetes would be sitting at probably around 126. Here's your hemoglobin A1c, which is a 90-day marker for blood sugar levels. So if I look at that, I'd say 5.2. That's pretty much in the functional range. You can see right down here, these are the ranges. I like to see this between 5 and 5.2. So initially I'd say, okay, her glucose, fasting glucose isn't crazy. Her A1c is really in the what I would consider to be the healthy range, right? This is why you need to take a global picture, a global view, and you're going to see this in a minute, like what's actually happening. And then once you get a guide, once you actually see some of these labs, it's like really, it's like the clouds actually remove, and you can actually see the sun, and you can put someone on some guided plan, some guided therapy that can get them better. Okay, so what I'm going to cover right now is vitamin D and how critical vitamin D is. When God designed us, He designed every single cell in our body, which we have about 100 trillion cells. Every single cell in our body has a vitamin D receptor. Now, I shouldn't even say vitamin D. Vitamin D is actually a hormone. That was a poor name. It's actually like testosterone, progesterone, estrogen. It is a hormone in our body. It's fat soluble. Every single cell in our body relies on vitamin D to do hundreds and hundreds of different activities. So, not every cell requires testosterone. Not every cell requires estrogen. Every single cell requires vitamin D, and every single cell in your body requires thyroid receptor. Those are the two things that are universal among every single cell in our entire body. Now, here's your vitamin D. I've taken thousands of labs, and check this out. This is 6.3. 6.3. So she was going to go and she was going to get stem cell of $20,000, but her vitamin D is sitting at 6.3. This is ridiculous. This is the things that are happening. This is why people are not getting well. They don't have fundamentals. And I say fundamentals, it took me a long time, thousands of cases that I completely failed on, to go back and look at what are these fundamental, the whole low-hanging fruit that must be in. Now look at the range here, 30 to 100. I've taken labs, thousands of labs. I've never seen a vitamin D of 6.3. So what do we know right now about every single cell of her entire body? This hormone, vitamin D, it's lacking. It's not there. Nothing is going to function better. Nothing's going to function well until we get this vitamin D up into the sweet spot. So you see the range, 30 to 80. When people are sick, you want to have this thing around 80. So if you go to conventional system, you see the range here is 30 to 100. If you go to the conventional system and you have problems, whatever problem it is, fibromyalgia, brain fog, brain fatigue, IBS, whatever it is, if they say your vitamin D is 35, you're healthy. That's not really the case. That's not what the research shows. Health is around 80, right? So we found that. So this needs to be addressed ASAP. Then we looked at some inflammatory markers. Check this out. This is C-reactive protein. What is C-reactive protein? C-reactive protein is a global inflammatory marker. So C-reactive protein is a global inflammatory marker right here. So what do we have here? We have 12, right? We have 12, and look at the range right here. Even the range, you want less than 3. Functionally, I like to see this less than 1. So she's at 12. One's normal, and she's at 12. She's what? That would be like 12,000 times normal, the lab rate, or 1,200 times normal, the lab rate. So she's chronically inflamed. So she's low vitamin D, and she has some kind of chronic inflammation. Is the inflammation because of low vitamin D? That's possible. Is the inflammation due to food sensitivities or not enough hydrochloric acid? That's possible. There's a lot of things that are possible why elevated C-reactive protein is high. But we know it's high, and we know this is a problem. Your body's never, ever going to recover in a body that is inflamed. This is why it's so critical to work with a practitioner that does a thorough checkup so you know what's actually happening. Here we have homocysteine. You can see the range here. I like this to be around 5 to 6. Now, homocysteine is a surrogate marker for DNA health. So if your homocysteine is elevated, that can tell you that the DNA that's in your body is not working very properly. It would be taking a copy of a copy of a copy, and the 1,000th copy, that DNA is not going to be very crisp. This is a surrogate marker for that homocysteine, so I don't like that. Now, is it ridiculously high? No, but it's one of these markers that if you take a polytherapy approach and you can find 5, 6, 7, 8 little things and move those just gently, guide people gently through the process, people can start to recover. You can get your life back. You don't need to continue to suffer. My dad died in the medical system at 69 years old. I lost 80 pounds. My nickname was Huge. I mean, I know there's suffering out there. All right, here's another marker. This is what we call the SED rate, sedimentation rate. This is an inflammatory marker. You see it's 26. Here's the lab range. Functionally, I like to see this less than 11. So again, inflamed body. Fibrinogen, this is another inflammatory marker that I like to see between 200 and 300, right? So she's at 400. So she's inflamed. There's chronic inflammation on a multitude of different avenues. Now, if you're inflamed, you're not going to have blood reach deep into the tissues. You're not going to have blood reach deep into the mitochondria and in the cell and feed the cells and feed the mitochondria, feed the brain and feed the muscles. You're just not going to, because your blood is thick. That's what inflammation is. It's thick blood. All right, I want to spend some time on this marker. This marker is very, very critical. Insulin. I have lots of videos on my YouTube channel on this, or my website on insulin. You see this marker here, insulin. You see this 41.8. You see the range is 2.6 to 25. I like to see this around 5. So what does this tell us? Insulin is a hormone, or basically it's a hormone that causes chronic systemic inflammation in your body. Insulin, high insulin, is like literally having glass shards run around your body and cause scraping of the arteries, scraping of the muscles, scraping of the DNA, scraping of the mitochondria. This is what's happening. Now, we checked the fasting glucose, which was 102, which is not bad, to be honest with you. And then we checked the A1c, which is 5.2, which is really in the sweet spot of healthy. But we checked insulin. We went further and we found insulin of 41.8, chronic inflammation. So we have a lot of things that we can do right off the chute, right off the bat, that we can start changing the physiology. Increase vitamin D, decrease inflammation, decrease the insulin levels in your body. You are going to recover. You are going to allow the inborn doctor to start taking over and heal your body. What's hindering your inborn doctor to not to function and heal? That's where the investigation needs to take place. That's where the functional medicine needs to take place. That's where working together one-on-one with someone that you know, like, and trust, and understand your problem, can move you to the direction of health. Now, I'll be the first one to tell you, I don't get 100% of my people better, but I get a lot of them better. And they get well because we've taken a polytherapy approach and did the right labs. Okay, so on that note, I wanted to bring you this case. And if you're out there suffering, contact me through, you can contact me through Facebook. I have a Facebook business page. I have a Facebook group. I'm on TikTok. I have YouTube. I have my webpage with lots and lots of content out there that I put out there, because there's too many people that are suffering in this world that need help, that need someone that can guide them, that can show them some love and understanding, and can actually sit there and have a conversation that I understand. I understand your suffering. I don't think it's all in your head. I don't think you're crazy. And your labs definitely don't come back normal, even though the conventional system says they come back normal. So a little more tidbit on this case here is, even on the labs that they were taken by the person that was going to do the stem cell, this C-reactive protein was also elevated, right? But they didn't say anything about it. And they didn't even do these labs, right? So anyway, I just want to let you know out there that you can get better. There's a possibility for you to get better. And remember, is where there's help, there's hope. Take care. This is Dr. Hugh.